Is every fever malaria? So welcome to Bobale Healthlink Clinics Uganda. Today I'm here with Dr. Bale and we are going to talk about is every fever malaria? So Doctor, welcome to the platform.
Thank you.
Yeah. Many people treat every fever as malaria. Is that correct?
That is one of the problems that we are dealing with as health workers. Fever in itself is a symptom of very, very many diseases. Though the perception in our communities is that when someone has fever, the thing that they are thinking about is malaria. But there are quite many. In the medical school, that is a big question for a medical student, because there is malaria, there is a flu, there is a cough, there is typhoid, there are even some cancers that cause fevers, even other inflammatory diseases like in the intestines, even the urea itself can cause fevers. So when the patient comes with the fever and what they are thinking about is malaria, they are missing out so many things. And this is why we are saying that the patient needs to see a doctor in order for them to get properly diagnosed. So not every fever is malaria.
Okay, so how is it dangerous for people outside there in our community to assume that every fever is malaria?
The problem we get with that is that everybody in the community has now become a doctor, and people trust themselves so much that they call fever a common symptom, and they think they can treat it. So the danger is that someone is actually going to treat themselves for fever without thinking that they need to see a doctor. And that places them in a very big risk, because there are many things that they could miss out. And while they are getting their treatment for malaria and taking their painkillers, complications could be arising. For example, if it is typhoid and you are treating malaria and taking your painkillers, it is not stopping the infections from do what they are doing. We have seen some patients ending up with the holes in their intestines, what we call perforation in their intestines, because of complications. They have been treating malaria, and even some places they have gone to drug shops and rural clinics, and have also not been identified with cases of typhoid. By the time someone comes, they are now a case that requires operation of the abdomen, because they have got perforations in the intestines. So it is quite important, and I really want to caution my viewers, the people who are listening, that you need a doctor to be able to take good care of your treatment for fever.
So how do we approach this? What is the best approach to solve this problem where we are treating fever as malaria?
Well, the best approach, first of all, is what we are doing, which is doing health education. From this video, you do it at your own risk. But I know we have given you brief of information about the risk of that. So health education, we don't do it enough, because many times when you come to the clinics, we are busy. We have people in the line and we want to clear our lines. So we don't give all the information, but you can always get that kind of information from here. The solution is health education.
So in other words, you are saying who is doing the health education? The health worker or the community members?
The health education should be done by the health workers. You can take use of our platform here at Bobale Healthlink and always keep getting more information. But also when you go to the health facilities, there are sessions that are usually arranged for health education sessions. Please attend. Don't think that doctors are now wasting your time teaching you, and yet you are sick, you want medicine to go back home. Attend those health sessions. They will help you to empower you for the next, how to handle health on other instances that may arise.
Thank you so much, Doctor. Now lastly is on the how can Bobale Healthlink clinics help us to solve such kind of issues?
Bobale Healthlink Clinic is an open platform. It is a platform that the community needs to adopt to be one of those solutions that have come up in Uganda to solve the health burden of the community, because it has doctors who are qualified, doctors with a lot of experience that the community can actually access at convenience. You may be distances away from where you can access a doctor. For example, many of our villages in Uganda still do not have doctors. But there is people have smartphones there, people have data and have internet. You can access a doctor from the village situated away. So one of the things we are solving is actually the discrepancy. Doctors may not be able to set up their clinics in the trading centers and in the rural settings, but this platform here, you can use it from your home and be able to see a real doctor online. That makes your life easier. It saves your cost of transport. It saves you from getting a wrong treatment. And we can work with your nurse at the next door drug shop to actually be able to get you proper prescription and proper treatment.
Okay, so if someone is doing like has malaria, has fever. Yeah. If someone is watching us and has fever, does it is it necessary for him to book a doctor at Bobale? It is necessary for them to book a doctor, and we are going to have a long chat with that person. We shall do proper history taking, proper clerking, the same way you would do when you go to a hospital. We would do that with you and establish exactly how your symptoms are, how severe they are. We establish also the possibility of complications that we may be dealing with. And we also collect laboratory samples for testing. We do not just treat you blindly. We collect laboratory samples. If you are within Tororo, we are able to collect your samples from your home and be able to test malaria. We are able to collect your samples for testing typhoid. We are able to even collect your stool sample from your toilet. We give you a bottle, you pick a stool sample, we do stool test for you and all categories of tests. Then we are able to prescribe for you the rightful medication that you can now go with to your musao in the trading center and get properly treated. Okay, thank you so much, Dr. Bale, for teaching the nation. So if you are outside there, what we have learned from today is that do not treat every fever as malaria, because there are other diseases which can also bring fever. So what you need to do is to see a qualified doctor who can prescribe for you the right medication that you need. And Bobale Healthlink Clinics Uganda is an online platform which brings a doctor to you from the comfort of your home. So join us today. Sign up is for free, and you can sign up and see a doctor within 5 minutes. Then you can go and use the prescription, or you can use the medical form and you get the medicine from your nearest clinic. Thank you.